The best way that I would describe RYR-1 is that it causes generalized muscle weakness, and that can be a wide range of symptoms from very, very mild to the point where someone might think that they're just a little bit clumsy, to very, very severe, where they are confined to a wheelchair, may need breathing assistance, may not be able to feed themselves, and so there's a huge range from mild to severe.
In healthy individuals, we are able to contract our muscles at the times that we want to and not when we don't want to, and generate a sufficient amount of force when we want to. Patients with RYR-1 myopathies, the primary problem is typically not being able to both have the muscles contract when you want to, but also as well and as strongly as you want to.
And it's hard to see the things he has to miss out on, like the birthday invitations he never sees because it's at a trampoline. The times where maybe he's not being included because he can't or because they don't think he can. And so those things make it very hard.
So the genetics of RYR-1 are a little bit complex, and that's primarily because there's two modes in which mutations in RYR-1 can be inherited or passed along. One mode is what's called dominant inheritance, and that's where there's an individual who has a single gene mutation. So everybody has two copies of every gene, and so we have two copies, one from mom, one from dad, of RYR-1. And when you have a dominant disease, one of the two copies doesn't work correctly. And so individuals that have dominant disease, if they are affected with their one copy, they can pass on that one copy to a child, and that child will also have the condition. So this is called dominant inheritance, where having the mutation makes it so that you have the condition. Then there's recessive inheritance, which is often what we think about when we think about rare and severe genetic disease. With recessive inheritance, this idea of carriers, where each parent may be a carrier for one change, and the combination of the two changes together is what causes the disease to occur. The third element that's a little bit confusing, often in RYR-1, is this idea of de novo. We all have new mutations that occur in us, in all of our genes. And an individual has a new mutation in RYR-1 that did not exist in either parent can be the cause of disease. And so you can have neither parent be affected for you to have a new mutation that makes you have RYR-1. So a really important question that I often get is, how important is genetic testing, and why should I get genetic testing? I know I have a myopathy. How is this going to help me? So my belief is that it helps in a couple of different ways. So the first thing is that we have this process that we call the diagnostic odyssey. And this idea is, I know there's something wrong with me or my child. What is it? And then individuals undergo a series of tests, whether they're blood tests, muscle biopsies, muscle imaging, and it can take years until there is a quote-unquote answer. So one of the main things about the genetic testing is that when it comes back and it's positive, you have an answer to what is causing your symptoms, which by itself is incredibly powerful. Once you have an answer, you now have some action plan about what to do with this answer. If I see a family and we find an RYR1 mutation, I can then counsel the family and also inform other clinicians about how to best care for that individual. The final area comes when you think about family planning. If one is interested in trying to figure out, will I have a child who has the same thing that is affecting me? What is the risk? How much should I be concerned about it? The ability to do genetic testing is what enables that. So knowing what your genetic change is empowers you to be able to figure out how to best plan your family.
Malignant hyperthermia is a potentially fatal complication, usually related to general anesthesia and surgery, in which someone with RYR-1 can have a severe elevation in body temperature, muscle rigidity, and ultimately death. So what's critically important is if there is a concern for RYR-1, that patient get tested. And if they do have an RYR-1 mutation, that appropriate precautions are taken if that person ever needs general anesthesia.
The RYR-1 Foundation has supported research in probably two important ways. One is simply by raising resources to fund specific projects. And equally important is by getting together a network of scientists to talk to one another, share data, encourage collaboration, interaction.
One of the things that's very important that the foundation is doing to get ready for clinical trials is to develop a registry, a list of patients that could potentially be entered into these trials, who'd be willing to participate in these trials. NIH is in the process of having one trial, and we're looking towards another one next year. We need a database of people who are willing to participate and are willing to work with us towards a cure.
Our primary goal is to help steer the direction of the foundation from a scientific and research effort. And so trying to work together with the Goldbergs and the other trustees to figure out the best way to marshal resources and use those to advance research and develop therapies for RYR-1.